we're talking about vitamin D toxicity just because it's been in the news recently. There's this guy in England who died of vitamin D toxicity. So I just wanted to kind of talk a little bit about vitamin D toxicity and just vitamin D in general. The guy's name was David Mitchener. He was 89 years old. He was this English guy who apparently had been taking high levels of vitamin D supplement for 9 months. And this was 9 months prior to his death. He went to the hospital with high calcium levels. Just a brief pathophysiology of vitamin D here. We're not going to get too nerdy with it. It's just vitamin D helps out with calcium metabolism, right? So we actually get vitamin D from the sun. This is the only vitamin that we actually make in our body. I mean, we need the sun's assistance. So we get sun, and then from our skin, the vitamin D travels from the blood to the liver where it's kind of activated. So it's in inactive form when we first get it. From the liver, it's sort of activated a little bit, and then it goes to the kidney where there's the final activation step. Vitamin D also helps with absorption of calcium from our intestines. So that's just a brief little summary of vitamin D pathophysiology. And it's one of the fat-soluble vitamins. That's important because fat-soluble hangs around for a long time. And as you know, if you've been listening, we've got lots of fat in all of our cells in the body. It's part of what makes up our cells. So anyway, this guy, David, he went into the hospital with high calcium levels, and he ended up dying because of congestive heart failure, kidney failure, high calcium, and then ischemic heart disease, which is kind of like a problem with blood flow in the heart. And the problem with having high calcium is that calcium, our muscles use calcium for contractions, including the heart. And so I don't know what this guy's baseline health condition was when he went in, but having high calcium is not good. And then it causes problems with the kidneys too. And part of the cause of his death, according to the coroner, was kidney failure, but he had some chronic kidney failure going on. What are some symptoms of vitamin D toxicity? So having too much vitamin D, it can cause weakness, it can cause fatigue, it can cause a feeling of not being hungry, it can cause bone pain. If it's really severe, it can cause things like confusion, agitation, being really irritable, and actually just like really weak muscles, and sometimes you can get into a coma. There's nausea and vomiting that can happen with it, constipation, some kidney symptoms associated with vitamin D that's too high. It's going to be too much urination, feeling thirsty all the time, and high calcium can lead to kidney stones, which is why if calcium's too high, we have people hydrate, so drink lots of water. And depending on what the level of calcium and obviously in David's case, it was really high, you're admitted to the hospital and given medications to bring the calcium level down, given IV hydration and whatnot. And then really high calcium levels can lead to abnormal heart rhythms because remember, calcium is used for the muscle and it helps with muscle contractions. So just having abnormal levels is not good. So then what are some signs of vitamin D deficiency? So if it's really mild, and this guy was in England, and in England, they use different kind of units than we do in the United States here. I'm used to thinking about vitamin D in international units. Okay, and then in nanograms per milliliters when we're looking at blood levels. If you're somewhere between 15 to 20 of vitamin D, nanograms per milliliters when we're checking your blood levels, that's considered low. Like normal is considered somewhere between 30 and 100. And we like people to be right in the middle, and that's somewhere between like 50 to 70. All right, so if you're on the lower end of normal, that's not bad, but having a little bit more vitamin D is good too. So you're not really going to have any symptoms when your vitamin D level is mildly low. But if it's really, really low, and so that's levels kind of like less than 10, you might start to have symptoms. I've seen people with levels less than 10 that aren't really having symptoms. And in fact, at one point, my level was 8. And I used to live in Arizona, which is a really sunny place. And right now I live in Nevada, which is also a really sunny place. But most people, at least in the United States and possibly worldwide, are low on vitamin D now because we told people to stay out of the sun or wear sunscreen. So people are wearing sunscreen in places like Nevada, California, Arizona, where I've lived. And so even when they're out in the sun, they're wearing sunscreen or they're all covered up, so they're not getting that vitamin D from the sun. And so that leads to vitamin D deficiency. And actually in my clinic on a regular basis, I would say about somewhere between 50% of people are low on vitamin D, and that includes me. So I'm actually on a vitamin D supplement myself. What are some benefits of vitamin D? Because it's sort of been vilified in the media, so to speak, because I know they talk about these things over and over again. And remember, this is not medical advice because you get medical advice from your personal doctor, but this is medical information for you to use so you can be knowledgeable about vitamin D and the things that you're doing with it. So I'm not at all saying start taking it if you haven't been taking it or stop taking it if you are. This is just some information. Always talk about supplements with your healthcare team. So some of the benefits of vitamin D, and since this is basically diabetes type 2 resource, we're going to focus on diabetes, but it's been involved with a lot of processes in the body. But for example, studies have shown that it's associated with insulin resistance. So low levels of vitamin D are associated with increased risk for insulin resistance and progression to diabetes if one doesn't already have that. So having normal levels of vitamin D is important for that. And then also it's been shown that people who are low on vitamin D who already have diabetes are at higher risk for diabetes complications. For example, foot ulcers. There was one study that showed people with diabetes who already had foot ulcers who had low levels of vitamin D had worsening outcomes with their foot ulcers. So that's one place where vitamin D helps. Obviously, it helps out with our bones. If you know about osteoporosis, which is the disease that has to do with the brittle bones, that's associated with vitamin D too. And actually, people with osteoporosis are on vitamin D and calcium supplements in addition to other medications. And then there are studies showing too that vitamin D has been associated with low levels of vitamin D have been associated with depression and anxiety too. So it's involved with a lot of things. So that's just some brief benefits of a vitamin D for you. What is the recommended daily allowance? So it's usually somewhere between 600 and 800 international units for adults, and for kids, which I'm not a pediatrician, it's 400 international units, and that's for kids under the age of 12. The equivalent to that in micrograms, which is kind of like sort of like English units, is somewhere between 15 to 20 micrograms. And so typically if somebody's low on vitamin D, depending on what the level is, like if it's like really low, like less than 15, they're put on high dose vitamin D for about 12 weeks. And then after that, they're supposed to start on just regular vitamin D supplementation that's over the counter. So what's high dose vitamin D? That's typically 50,000 units, and that's just once a week. And that's for 12 weeks. And then once you're done with that, then you're supposed to just start taking over the counter vitamin D. And we're checking the vitamin D levels somewhere between every 3 and 6 months. So if somebody's stable on it, then it's every 6 months. If somebody's not quite stable, we're monitoring the levels, then it's about every 3 months. We get vitamin D from the sun, but not enough. And by the way, if you're light-skinned, you're absorbing more vitamin D from the sun than people who are darker skinned. So people who are darker skinned because of the melanin, we're not absorbing as much vitamin D. So people who are darker skinned are at higher risk for vitamin D deficiency also. So that's something just to think about getting checked with your doctor if you don't know what your vitamin D level is. We get some vitamin D from the diet too. And so some foods are fortified with vitamin D, and that's going to be things like orange juice or yogurt. It'll say on the label fortified with vitamin D. But then there's other foods like fatty fish have vitamin D in them, egg yolks, and then cod liver oil has vitamin D in it too. But we just don't get enough from the sun and not quite enough from the diet. It's been kind of found in studies. So a lot of us have to supplement with vitamin D. So it's typically 1,000 international units daily. But I've had patients where I've had to go up to somewhere between 2,000 to somewhere between 2,000 to 5,000 international units daily just to get their vitamin D levels into kind of a reasonable range. And also, if you remember during COVID-19, there was a vitamin D craze. You couldn't even find it on the shelves because vitamin D also helps out with immunity. And so in my experience, how often have I seen vitamin D toxicity? Not a whole lot, because we're monitoring it. I don't know about this gentleman that died recently, like what his health care was like, whether he was having his levels monitored or what exactly was going on. Because this, I mean, he'd been taking this for 9 months. So it almost sounds like he wasn't being monitored. But the highest that I've seen, so the upper limit of normal here in the United States has, at least, is 100. So I've seen like 120, 150, and people aren't having symptoms at that point. But I tell them, stop taking it and make sure you're drinking enough water, because now you've got a little bit more calcium hanging around too. And high calcium increases the risk for kidney stones. As you can see, vitamin D is kind of important and it does a lot of stuff for us. So it is something that people are deficient on. And there's some studies showing, at least in the United States, that somewhere between 30 to 50% of people at any given point in time are deficient on it. And even if you go to like the colder climates, especially during the winter, people are covered up all the time too. So they're not getting sun either. Needless to say, we've told everybody to wear sunscreen too. So even during sunny times, people are wearing sunscreen, because then if you're not wearing sunscreen, you're at risk for skin cancer. Just remember that supplements, right? They're not regulated by the FDA, at least not here in the United States. If you are taking a supplement, you're taking it at your own risk. This is not to say that supplements are good or bad, but just to know that. And they actually have to say on the label, they have to have a statement on the label. So actually, here is my vitamin D, and this is from Costco. So it has to say on there that the statement, so they can't claim to treat any disease since they're not regulated by the FDA. So this statement has not been evaluated by the Food and Drug Administration, and this product is not intended to diagnose, treat, or cure or prevent any disease. They have to have that statement here in the United States. And it actually sounds like in England, where this sort of overdose happened, they don't really have regulation of supplements either, and they're working on getting more regulation. All right, so that is it, guys. I just wanted to talk about the vitamin D toxicity thing. And in my experience, it's not that common, but then again, make sure to discuss any supplements that you're taking with your healthcare provider. Thanks for joining me tonight. We will see you guys all next week.